Hi, so I'm here performing an esophageal suctioning. So I already did check the patient's chart, and after that I also did washing my hands. So now I'm wearing a clean gloves. So after that, I'm gonna prepare all the necessary equipments such as the basin and the tray, and then we have here the sterile gloves. Here is fully open that, and then we also have here the lubricating jelly, and with the suction catheter we're gonna have we should pour appropriate amount of sterile water inside into the tray. And with the lubricating jelly we can either prepare it in here in a clean area, or we can also put it in a clean gauze. So after that, I'm gonna assess the patient by listening to the breath sounds, checking the level of consciousness, checking the SpO2 and everything. So once I'm done assessing the patient, I'm going to prepare necessary equipment such as the suction regulator. So I'm gonna turn this one up and then set this in 120. So the ideal for adults is within 120 to negative 150. So it should not more than 150. So after that, I'm going to check the tubings. Make sure there are no any obstructions on it, and then there should not be kink. So we should be able to notice the gauge to go high. It's not more than 150 for its functionality. So after that, we're gonna hook it up in a nasal trumpet in here. So with a nasal trumpet, we should be able to measure its size from measuring it from the nose until the earlobes, or also we should be able to notice it with a bevel if it's the hole is just too small or too big for the patient's nose. So once we're ready, we have to lubricate as always the nasal trumpet to ensure that we're going to insert it smoothly. And then when we insert it, should not insert it too much, should insert it gently in the patient's nostrils till that. And then every time we put that one, we should hook it up with a non-rebreather mask to ensure we're able to hyperoxygenate the patient by hooking it up in non-rebreather and set the flow. And then prior to putting this to the patient, make sure that we're able to notice the reservoir bag to inflate. So assuming it's already inflated, we're gonna put it in the patient. So we're gonna hyperoxygenate first while preparing all the necessary things. So once we all did this, I'm gonna dispose the clean gloves, then sanitize again my hands. So after sanitizing my hands, I am going to wear also another set of PPE such as a gown, a face shield, a mask, especially if we notice the patient to have multiple secretions. And then I'm going to wear the sterile gloves. Make sure that you're not able to hit the sterile gloves in other parts, especially in the table or in the hospital bed. So after that, we have here the suction catheter, and then we're gonna insert this one up with the suction tubing until we hear a noise, which means that it's able to suck it up. So before putting it in the patient's nostrils, we should always re-sterilize it with the sterile water, and then be able to check if it's functioning correctly. And then we always lubricate it with a lubricating jelly in this clean container or in a clean gauze. And then prior to putting that, we have to remove the oxygen and then insert it gently inside to the patient's nostrils. If we feel any resistance, we should able to notice that it reaches the vocal cords. So we should able to let the patient cough or breathe in, and we should also check inside the patient's mouth to check if how long the suction catheter it reaches. So assuming we reach the appropriate place to suction, I'm gonna suck it up, obstruct this one, and then every time we do the suctioning, we should not do a circular motion to prevent any complications such as laryngospasm or bleeding. And then after we